Hello there. Welcome to Plus Talk on Plus Life, where we're all about turning positive into a plus. My guest today, Dr. Monica Gandhi, has been doing that for years up in the Bay Area. Good to see you, Doc.
Nice to see you.
Thanks for doing this. So, I want to talk about aging with HIV and adherence to meds because aging with HIV is a big thing, especially in this country. Thank God so many of us are surviving and living longer, but it does present its own set of problems. Why is it important for people living with HIV to get on and stay in treatment, Doc?
Well, all the benefits of antiretroviral therapy, which are immense, relies on taking it essentially. And so people can have normal lifespans, children, reproductive desires, reduce the inflammation that comes with HIV, not pass it on to others. All of that relies on taking these pills every day, which can get exhausting because if you've had HIV for a long time, taking a pill every single day can start becoming a slog. That's called pill fatigue. And sometimes we have to think of novel ways to stick to the adherence to HIV therapy.
Yeah, well, so let's break that down a little bit more. What is pill fatigue? Is it literally that simple? I am exhausted of taking my pills and being reminded I've got HIV every day?
It is exactly that because, in the sense that there's, of course, stigma that's ongoing from society. That stigma is really, we're kind of in this unprecedented tide of more stigma on LGBTQ communities, which I find astounding and horrifying. And then the internal stigma is it reminds you that you have HIV to take a pill every day. And I think we can't underestimate what that feels like. I have a patient who every time she put a pill in her mouth, she would throw it up. It didn't matter what the pill was. And I finally really tried to get to that. And she said, it reminds me I have HIV. I can't do it. I can't take any pills. I can't.
So, what are some of the most common barriers for people living with HIV to, when it comes to adherence?
So there are a number really. I mean, it really depends on population and person and even city. But it's forgetting can be as simple as forgetting. It can be substance needs, having housing insecurity, food insecurity. It can be that there are stockouts or transportation issues. It can be stigma from the outside or from the inside in taking it. It could be substance use and all that that comes with in terms of forgetting, mental health issues. So there are so many reasons why it's not that easy for everyone to take a pill every day. And then pill fatigue can just be having HIV for a long time and just hitting a wall, can't do it anymore.
And we should point out that that's okay to feel that way too. If you are
Yes.
feeling pill fatigue, it's okay, isn't it?
It is. I mean, it is. There are some people who took the hardest regimens, handful of pills, multiple times a day, lots of side effects, have just gone through it all. And at a certain point, your body just says, no, I can't do it anymore. And are there other ways to get HIV meds in my body without taking a pill every day?
And we'll get to that in a second. But what are some of the unique challenges that people who have been living with HIV since those early days, what are some of the challenges that they face, especially when it comes to the effectiveness of some of the more common, like one pill a day treatments?
Well, if you've had HIV for a long time, the pills early on were really hard to take. I was an HIV provider during that time, so I know this firsthand. They were so nauseating. There was a lot of side effects. They had to be taken at different times of day, some with food, some without food. And just to have gone through that, it's was so hard that sometimes there's resistance in the virus to some of the newer pills that we have now that are one pill once a day. So it seems like it should be so easy to take one pill once a day, but if you have resistance, then you can't actually be on those easier to take regimens. And then there were side effects of those pills that led to kind of long-term body changes called lipodystrophy, but there are longer term side effects of some of those pills that result in body morphologic changes and also kidney issues and bone issues. So all of that is real. I mean, taking medications for that long, you can have these adverse effects. So at this point, we have to think that it's not just like being newly diagnosed and getting on one pill once a day. You've had a history.
Yeah, and I would imagine that there's got to be sort of an emotional toll that can take as well. It's all good and well. I sit here and go, I take one pill a day and I'm undetectable. I have to sort of put myself in other people's shoes and go, well, bully for him. That has to,
Yes.
play an emotional role in going, well, gosh, it's not fair. Why do they get one and I have to have this, right?
People who've had HIV for a very long time have gone through a lot. EZT monotherapy, failing drugs, coming in, having 2 drugs, all the horrible side effects. Sometimes it landed people in the hospital. Sometimes your body just says, "No, I can't do it anymore."
Yeah. Tell me about this long acting injectable, because this might be something that can help those with pill fatigue, right?
Yeah, so we really, we're kind of in the nascent edge of, like, long actings. Hopefully, we're gonna get many, many more. They are essentially given as injectables, so no pills. Given as shots, mostly in the butt, actually once a month or once every 2 months at a higher dose. And we have been trying at Ward 86, and some other clinics have done this as well, trying these in patients who have pill fatigue, who are sick of taking oral ART, or because of those other barriers, housing insecurity, substance use, can't take oral ART. We've been trying these out. Now, the reason I say trying is that's not actually how they're approved. They're approved kind of for like the perfect patient. Like, it's like you take oral ART, you have no issues taking it, you're totally virologically suppressed, and then you go on to take injectables. That's not the population that we wanted to try these on, because we knew we were waiting for these medications to try to help people that couldn't take oral ART. So we've been publishing our demonstration data that shows that it's working really well. Long acting ART is working really well for people with pill fatigue, for people with substance use, with people with out on the streets, unfortunately. And it has been working. They do work. Other groups have now done this. And now there are thought leaders saying we need to put this on the guidelines to say, if you really can't take pills, we have an option for you. And then more options are coming. So we're at a very good point in that way for long acting right now.
What about potential side effects other than a little bit of an ouchiness where you get your shot? Are they pretty much hand in hand, similar to my one pill a day regime?
Yes, it's really the same as one pill once a day in terms of side effects, but the pain at the beginning can be significant, meaning it is truly a shot, and some people hate needles. But that pain seems to go down with time, we do, like, warm up the medication, rub the area, make sure if some people really need, like, a lidocaine patch to make it less painful. But I've been really surprised that people are saying, "The first one hurt, and then after that, I didn't feel it as much."
Well, there you go. What's your advice to someone, doctor, who may be considering the switch from the pills to this injectable?
I would say talk to your doctor about it, because I actually think that some people really like it. And then some people try it and they're like, I'm okay with the pills. But I will say that people are so positively motivated if you've never had suppression of your virus in your entire life, and then you get on these injectables, and for the first time your virus is suppressed, that people actually have been coming in monthly or every 2 months for their injections. So I'm very impressed by that. And I can tell that people are into it. And it's been really, really a game changer for a lot of people. The one thing that people like about it, there's this freedom that can occur from not having to take a pill every day. And I have been impressed that people like that. So I would just say, if you're thinking about it, go and talk to your provider. I think it's worth trying.
Yeah, well, listen, as a scaredy cat to needles, I'm fine with my one pill, one a day. But when they get it to maybe one shot every 6 months, I
Yes,
think, and I know that's coming.
it's
So,
going to come. Yeah.
yeah, exactly. So I'm going to hold out and see how that goes. Dr. Monica Gandhi from Ward 86, thank you so much for all you do and for taking the time to chat with us today.
Thank you for having me.
That's going to do it for this episode of Plus Talk. Now, if you want more information about what we've talked about, please check out the website, pluslifemedia.com. And you can follow us across social media platforms. We are at Plus Life Media. Until next time, be nice to one another. Take your pills. We'll see you soon.